Yeah.
No.
Okay, perfect.
Here comes the bus.
Yeah, I know. It's gonna crash. Right. And
Listening to podcast is no replacement for real training. While we attempt to provide accurate commentary, we hold no responsibility on how you use the information we provide. Get medical training. In the blink of an eye, everyday order can be replaced with once-in-a-lifetime chaos. Be prepared. This is the Civilian Medical Podcast.
welcome to the Civilian Medical Podcast, episode 31. My name is Sean Heron, and I'm here with my good buddy, the Skinny Medic. Dietrich, what's up?
How are you, sir? I'm doing great today.
Same, man. I'm doing great. It's cold in the studio, but I wanted to get something out of the way right up front. The elephant in the room, if you will, which is apparently me. I saw those new shirts that you guys put up at ballisticink.com. And what's the story behind that? You just like trying to hurt my feelings for Christmas or what?
This has been going on since like range day. I talked to the guys at Ballistic Inc. And I'm like, look, we definitely need a Civilian Medical Podcast shirt. The podcast is gaining ground, like gaining traction. We're getting lots of reviews and all this cool stuff. I want a t-shirt. And they're like, all right, cool. What do you want? I'm like, well, I want a skinny guy and a not so skinny guy on the front of the shirt. And they're like, okay. They're like, any other requests? It's like, nope. I was like, we're both into guns. We're both into medical. Like, whatever you guys come up with, this is your design. You guys go with it. And like last week, they sent me a text and said, here you go. Here's your picture. And I was like, oh my gosh, that's hilarious.
I thought you were making fun of me. I told Skinny Medic he could be Skinny Medic and I'd be slightly overweight Medic.
I was just like, oh my God, this is awesome. It is. Dietrich and I are carrying a litter, and it's stick figures, but they are anatomically correct, basically. No, it is awesome. Just go check out. It's in the Skinny Medic store at Ballistic Inc., right?
It is.
All right, very
we'll
cool.
Put a link in the notes for that. But yeah, go to Ballistic Inc. under the Skinny Medic store. And it's there. We've got t-shirts, long sleeve shirts, and hoodies.
Wonderful. I love it. You may have heard her already talking, but we have our first return guest. I guess we just inspired her so much after the last one that she decided to come back and talk about something new that she's doing. Please welcome Brandy from Iraq Veteran 8888. What's up?
Hi.
How are you doing?
Fine. I decided I didn't want to be a closet medic anymore.
I was going to say, I think I'm the one that can take full credit for this one, if not partial credit, because I was like, as long as I've known Brandy, she has been a closet medic the whole time. She has a great first aid kit. She's always been super interested in doing like sutures, like first aid. Like I came down to y'all's place and did my trauma class there. So you've always been interested. So I was just made a joke, said you're the closet medic. And then next thing you know, you're like, hey, I think I'm going to go to EMT school.
Yep.
That's awesome. Like, okay, so tell us how, I mean, clearly you've always been interested in stuff like that, but when were you like, you know what, I'm going to do this?
Well, I've always had, like, I think we discussed this last time. I always had a, passion for helping people. And, of course, the human body itself is just fascinating in the way it works. And I don't know. I mean, I took human anatomy as an elective my senior year in high school, if that tells you how much of a nerd I am.
No
yes,
doubt.
I did call you a nerd when you told me that. I was like, you're such a nerd.
You're such a nerd.
I took like 2 or 3 gym classes.
I went to gym class once. Hated it. It was awful.
Oh, yeah. I went. It was fun. That was like my senior year. I had like 2 or 3 gym classes. It was great.
Okay, that's pretty funny.
I had 2 ROTC classes my senior year because I was a student instructor for one of the classes.
Nice. That's awesome. All right, Brandy. So you decided to do this, the EMT thing. I want to talk to you, like, how did you find the place to do it? Like, where did you start? You made the choice and you were like, okay, the first thing I'm going to do is.
We have a local college that is a technical college, and they have a pretty extensive medical training facility for, there's no doctors that are trained here, obviously, but nursing, EMT, dentistry, paramedicine, all kinds of you can learn how to do x-rays and pretty much any of the, anything underneath being an actual doctor.
That's cool. Yeah, we've had a few people ask us about, all right, look, your podcast inspired me. Maybe I do want to get in the medical field, and maybe I do want to become an EMT paramedic. So that's kind of why we thought, hey, Brandy's starting this process. We should bring her back on and kind of talk to her, like get a pre-EMT class going, and then maybe a few months when you've got some time under your belt, maybe the first time you rode on the ambulance, let's get you back. And it's like, all right, now what do you think? Like, you've rode on the ambulance, stuff like that. So I'm excited about this adventure for you. I think it's gonna be awesome.
I'm excited and a little nervous just because I'm the oldest person in there besides the instructor, and then that's cutting it close because they might be right around the same age as me.
And I was kind of wondering about that. Like, I know that you are ridiculously busy. How are you going to fit this into the schedule?
It's night classes.
Perfect.
I know. I don't sleep anyway, so.
You're going to run the business during the day and go to night class.
That's right. 3 days a week. Well, not really. They're hybrid classes, so some of the learning is online, a lot of just instructional stuff, reading and taking tests and stuff. And then, of course, there's classroom time. And then later on, probably in the second and third semesters, I'll be doing the clinicals. And they said the clinicals will be some experience in the actual ambulance and then some in the ER. Nice.
I would not worry about being the oldest person in the class. I feel like I've had students on both sides of the spectrum, kids straight out of high school that are getting their EMT, and I've had people this is their second career. They've already retired out of one, and now they're going to go, hey, I think I want to do this. And for me, I have no problem with that older generation, and I called you older generation, don't hurt me. But coming in, because you have tons of life experience to bring to the field, to bring to this career. So if you decide to make it a full-time career, decide to make it a hobby, when you're on the ambulance, you have some life experience to go along with this. So when you do need to talk to somebody, you're able to talk to them, able to communicate with them, and able to help them through their crisis, what they're having.
I never considered that. That's a good point. I do know that I have this uncanny ability to be really calm in situations like this. Like, there's been times when I've had a child walk in with blood running down their leg, and they're like, we need to go to the hospital. And I'm just like super calm. And then later on, it kind of hits me, and I'm like, but yeah.
Do you is your goal to like be on a rig and running calls and things like that?
No, ironically, while we were at orientation the other day, we're all sitting in this classroom talking to the instructors, and there's a bunch of young guys in there, and there's a couple of females, and then there was this one gentleman who looked like he might have been in his 30s. He was real quiet, and we were talking about the instructor was talking about how recruiters will come at the end of the course once you get your diploma or whatever, and they will recruit you. And they're not saying it's a guaranteed job, but they're saying that there's a pretty strong chance that you'll get a job.
It's a guarantee.
Right.
There's a huge shortage right now for EMTs and paramedics, so it's a guaranteed job.
So anyway, I kind of mumbled under my breath. I was like, well, I'm not here to get a job. And they're looking at me and they're like, what? And I said, well, I'm just here to gain knowledge. And the instructor, he leans over and fist bumps me and said, right on, And so then the conversation turned then to, well, what do you do for a living? Which I was like, well, it's kind of complicated. And I went into the spiel. And when I get to the part where I'm like, yeah, we're one of the largest gun-related YouTube channels in the world, these two young boys, I'm talking straight out of high school, they kind of start whispering to themselves, and they were like, well, what channel is it? And I said it, and they were like, oh my God, we love that guy. We love that channel. And as they were leaving, the one was talking to the other one. He's like, I can't believe we get to go to school with Eric's wife.
That's hilarious.
I told Eric, I was like, well, I made friends already.
That's awesome. when you were looking, so you clearly you have that local place that has a bunch of medical stuff. What kind of financial options as far as like aid? Was it like, did they have like kind of pay in full, pay as you go, like, I don't know, assistance?
Well, this should I shamelessly plug the college? I mean, I can, right?
It's fine with me.
Yeah, I'm fine with it.
We're here in Georgia, Southern Crescent Technical College or Technical Institute. I'm not. Anyway, they require all the students to file the free application for student aid, and that basically will determine it. It's all linked to your tax returns and stuff like that, and that'll determine whether or not you qualify for certain programs like the Pell Grant, the Hope Grant, the Hope Scholarship, and all that kind of stuff. And a lot of people do qualify for those things, even though they don't know that they will, and that helps pay for your college. And the classes really, I think it's $100 per credit hour for this particular college. So the completion of this one semester, if I don't have any student aid available to me, it's going to cost me like $1,900.
That's not bad though.
It really isn't.
For sure.
And of course, younger people, they're like, "Oh my gosh, that's a lot of money." And, well, I mean, it's not like going to, a college for like UGA or something. It's going to cost you $20,000 a semester.
Definitely. And I got some notes that we talk about in a little bit, but so $1,900, but you come out making decent money as an EMT if you decide to get on an ambulance, things like that. So, and kind of talking about where you chose, if someone is listening to this podcast, I would definitely say do some research, which place you wanted to get your EMT or get your paramedic from, because not all schools are created equal.
Right.
You may go to a school and they have older mannequins, older stuff. And then you go to another college, another school, and they have high fidelity mannequins that are computerized and can talk, and you can do all this crazy stuff with. So you get a lot better experience. Some places and others, you still get the same, certification, but your experience through class may be different. So I would definitely ask around. Maybe there's a couple of places near you that do it, and just kind of compare it and talk to them. And then, one of the places that I teach at, their firefighters are getting their EMT for free. So if you're already a firefighter, the school will teach you EMT for free. And so there's things like that to do research on and kind of figure out the best place that fits what you require. Maybe it is a night class, maybe it's a day class, but kind of do some research there.
Right.
All right.
And I was just, Jacob, my youngest son, his girlfriend went to school over here at Southern Crescent for dentistry. She's a dental assistant, I believe. And I think she wants to go back and be a hygienist. So I already kind of had a feel for, like, I observed her taking her classes and the kind of homework and things that she was doing. And it seemed like she really enjoyed the school, and it seemed like she got a good education. So that was the first place I looked, basically because it's convenient for me, and it just so happens it's a pretty good school.
That's huge.
And I think having your EMT as a backup is that's like Sean and I were talking about before you came on, that I will always keep my paramedic, because if something happens tomorrow, it's a medical gear, I need to have a backup plan.
Right.
And I still love being a paramedic. So for me, getting back on an ambulance full time would not be a big deal. For me to go be a paramedic instructor tomorrow would not be a big deal. So I love EMS. I love that career. So to have something as a backup, something to do on the side, it's always good to have a backup plan.
Yeah, and I kind of thought that, if the YouTube thing ever goes to the pot, well, now I have a backup plan too. Well, I mean, not like I don't already know a few things, but that was a double negative, I believe. Sorry about that. But I have knowledge in other areas, and I've learned a lot since I've started working with the social media stuff. So, I mean, I think I have some options, but, I've also considered that once I complete this course, depending on what my workload is going to be, if I struggle, to complete the classwork while I'm still, gainfully employed, I may go back and complete some other classes. Like I may go back and take some additional classes to be the actual, a paramedic, or maybe some other, medically medical classes, I should say, I guess. I don't need to be a nurse. I don't have time for that.
Right. Yeah, but once you get your EMT, get on somewhere, local department, something like that, and then just go to their training, their IST, in-service training they have every month. And that gives you your credit hours to recertify your EMT. That way you don't have to retake the class again.
Right.
But just keep going to IST, and like my service requires 24 hours a month. Maybe it's 48. I don't remember, but it's not that much time to devote to it and pick up some time and have some fun.
Sounds pretty cool. Brandy, how much school are you going to have to go to for this?
This is 42 credit hours. And my first semester, I actually have 5 classes, but some of them are kind of tiered. So, like the one class is the first part of the semester, and then the second class is the second part of the semester. So it's not like I'm going to have 5 at one time. I'm going to have at the most 4. The medical terminology, I think, is mostly online, and I don't think that's going to be a big challenge for me. Anatomy is actually, I have to go to the school. They say that it's a 4 p.m. to 10 p.m. class, but our instructor informed us that he is rarely ever there till 10 p.m. That we usually, we'll get out of there before that.
If you're still there at 10, turn the lights off for him.
Right.
I'm like, well, I don't sleep anyway. I might as well learn something. So, the anatomy is going to be a refresher for me. The medical terminology, I'm probably going to learn some new things, but the rest of the course, I think, is going to be mostly new knowledge. So I'm excited and nervous a little, just because any kind of big change I have in my life, I always get a little nervous.
Definitely.
Yeah. Dietrich, what was the hardest class for you when you first got your EMT?
A&P was tough. A&P, it was a fast track class. So basically we were just doing a chapter a night, and I was like, holy cow, like I was drowning in everything. So like I even told Brandy, I was like, for me, A&P is I didn't.
Oh, you told me.
Yep. I did not try to learn A&P. I just tried to memorize it. Like, if that makes sense. Like I was just like, all right, what do I need to pass the test to get through it? Cause it was a fast track class, and that was probably stupid of me to take it that way. But I smoked through it and passed it and was like, all right, cool, we're good to go. Start paramedic now. But that was a tough one.
And I don't know how in-depth this anatomy class is going to be, but when the one I took in high school, we actually dissected things. Like I dissected a sheep's brain, a deer heart, a fetal pig, and a lot of other things that just, it gave me the experience to see how things, like how the little body is. The fetal pig was my favorite because everything was there.
So my story on that one was we had an opportunity to go to an autopsy, and the doc was doing the procedures. Like, look, it's 60 degrees in this room. It's cold. If you get warm, like a flush feeling, you need to sit down. You're getting ready to pass out. I was like, man, I'm good. Like, I'm fine. And they started dissecting this body, and he took a saw, like a power saw, to the chest. And I was like, okay, that's gross. And he pulled out like the lungs, the heart, everything, cut the throat. It was like it was a turkey, and like laid it across the stainless steel table. And I was like, oh, okay, there's that warm feeling he was talking about. Like I remember it feeling like felt flush. I was like, all right, I'm good. And then he took a circular saw and cut the skull. And I remember the skull going, that popping noise. I remember it. I was like, oh, that's gross. And like I sat down. He's like, you okay, buddy? I was like, yeah, I'm good. It's in a second. But it was awesome to be able to dissect and see the heart, like see the chambers. But I'm like, that is gross. Like, I mean, I've done deer. We've done some stuff, but I'm like, that's just seeing a body, like seeing, like he peeled the face back on the skull. I'm like, that's jacked up. Like, it takes a certain person to want to do that for a living.
I bet.
Yeah, I can definitely imagine. So what other advice do you have? Like A&P was tough. Like any other things that kind of stood out or were super, super rough?
I just would, I would enjoy your ride time. Hopefully you do not get a burned out paramedic that's like, just salty as, whatever. But hopefully they want the student and they want that encouraging time. So Typically, like when I was full time on the ambulance, I would hand the EMT rider, like the oxygen bag, and like because it had the non-rebreather, had the nasal cannula, had everything for airway in the bag, and I'm like, all right, this is your bag. When we get on scene, you can do whatever you want to with this bag, and then you can talk. Like I want you to take a blood pressure on every single patient. This is your job. This is your what I expect out of you for the day, and let them have fun, let them play. Like, this is your time to enjoy and ask questions. Ask, if you're curious at all about the departments you're riding with. If you get a chance to ride with multiple departments, pick a couple different systems to ride with, because every system is different. Every system has its advantages and disadvantages. So kind of look out there and say, this is somewhere I may want to work part time, or this is definitely an area I don't want to work part time.
Brandy, how long do you expect? You said 3 semesters, so like calendar year. How long is that going to be?
According to the schedule of events, I should have my diploma by the end of the year, 2020.
Nice.
That's awesome.
That is awesome. Skinny Medic, how long did it take you?
It took me 2 years because I got my paramedic. So there's different levels of EMS, and some people may not realize that you have your EMT basic. And that's what the class that Brandy's taking. And then you can get your advanced, which is a little bit more than EMT. You can start some IVs, you can give a little more medications, kind of do a little more stuff. And then your paramedic is able to do everything. You're able to intubate, you can use a cardiac monitor, you can give lots more drugs. And that's a 2-year associate. Typically, it's an associate's degree for that. So, I mean, you can get just your certification, which is your EMT certification or your paramedic certification. Or you can get a degree, and they start with all your associates, or you can get like your master's degree in like emergency management, emergency medicine, stuff like that.
Very cool. I'm pretty interested in this. It's something, Brandy, that I've actually considered doing a couple times. It's just like, where do I find the time? I feel like I'm constantly going. So was it a tough choice for you to do this? I mean, you said you don't sleep, so I mean, clearly homework in the middle of the night. Thing. Was it a tough choice?
Not really. It's something that I've wanted to do for a very long time, and I finally just took the plunge. It's like being pushed in a swimming pool. It's like I just went over to I signed up, for admission, and then I got all of my transcripts from my previous college and my high school, and I sent everything over, and I bet these people thought I was crazy because they're probably used to dealing with people straight out of high school that don't know what the hell they're doing. And I've done this a time or two. So I was like, here's this, here's this, here's this, here's this. And the lady was like, oh, well, you need to take this. No, ma'am, I don't. It's right here in my old school. You look at this and this and this and this. Oh, yeah, well, that probably will transfer over. And then she's like, well, I have you as a foreign resident. Honey, I was born right here in this city. I'm not foreign resident. I'm right here. So then I shot over my driver's license and my something else. What did I send her? Anyway, she was like, oh, yeah, you are a resident. No, yeah, I am. So the most lost that I got was I went over to the school and I'm like, where do I go now?
Right.
I walked in the door
building
and
am I
I'm
supposed
like,
to be in?
what do I? Yeah, because there's actually a separate building for the medical. So I had to walk across the parking lot to the other building. But, I'm personable. I make friends with just about anybody. So I don't think I'm going to have a problem with anybody. I already made friends with the instructors. We've got the one guy who looks like a little bit more, an older version of Such. And it's like Such and John Willis had a baby.
Oh my gosh.
Oh no.
He looks like Such, but he's got like the John Willis beard.
That's hilarious.
But yeah.
One of the schools around here, they have a bunch of buildings too, like we're talking about, but their EMT program actually responds to calls on the campus. So they if there's an emergency, it's part of their plan, the EMT class gets up and they'll go respond to the emergency on the campus while EMS is coming.
I mean, it makes sense. It sounds like you have a pretty good system there.
Yeah, I know that it's ironically, before I went over to the orientation, I'm online and I'm digging through, because I research things. I'm digging through the student handbook and all this kind of stuff because I'm wanting to know if I can carry.
You're such a nerd.
I am. I really am. And I'm the girl that, if we're going to a restaurant I've never been to, I'm online looking at the menu, looking at the reviews, find out what people say, what people think are really good. Like, I research stuff. And here I am over here, and I'm looking through the handbook, and I was talking to Jacob's girlfriend about orientation, and she says, well, I didn't even go. I was like, yeah, well, I was looking through the handbook. She's like, you read the handbook? Like, girl, you don't even know me. So I found out that Georgia is a campus carry state. And believe it or not, they covered it in the orientation, what you can and can't do on campus as far as carrying your weapon.
That's interesting.
You have to have a concealed carry permit. You can only carry a pistol or a revolver, and you have to keep it concealed. And you can't carry during like disciplinary hearings or sporting events. But other than that, you just have to follow the law.
That's interesting. Yeah, because the place I teach at, it's on the hospital grounds. So that kind of throws a monkey in the wrench as far as South Carolina is concerned. So usually when I'm teaching, it usually takes about like the first week of the semester, maybe 2 weeks in the semester for people to start figuring out who I am. Because I don't tell them. I'm like, I don't tell them that I do YouTube videos. I just let it go. And then usually like a week or two in, they're like, wait a minute, you do YouTube videos. I found your video on this or that. And then they're always like, so do you have a gun on you? And I'm like, it's against our policy for me to have a gun on me. And they're like, yeah, I know, but do you have a gun on you?
Have it anyway.
And I was like, it's against our policy for me to have a gun on me. And they're like, okay, but if something bad happens, I'm coming to your classroom. Sounds great. So the guy in charge, the head director one day said, hey, got a question for you. And I was like, okay. He goes, do you have a gun on you? And I was like, is this an official question or like how strict are we being here? And I was like, your policy says I cannot have a gun on me. And he was like, oh, I know what my policy says, but I just would like to know. He was like, I know we have a few instructors that are probably carrying. I just want to know. And I'm like, sir, it's against your policy. He was like, okay, but if something bad happens, I'm going to come to your classroom. I'm like, sounds great.
That is awesome.
They just didn't know what I had in my purse.
Yes.
Probably like a rocket launcher or something.
No.
She drove the tank up to class. It was like, all right, get another tank.
Hey, we might have a Hummer one day. Eric says the next vehicle he wants to buy is like a Hummer. Like, he wants a replica of the one he had in Iraq. We'll see if that happens. I don't know. I don't know if I've given him approval yet from the accounting department.
I want a Hummer too. Like, I want one just to get coffee in, just to drive up to a little, like, because we live in a little small town. I just want to be able to drive up in a Hummer and get coffee.
Well, if you're not real picky about the kind of Hummer you get, I have a website where you can buy them sometimes dirt cheap.
Nice. Because I've been following who's the guys out of Atlanta that you know, Brandy?
If you wouldn't have asked me.
Is it Combat? What is it?
Damage Control Customs? Is that him? No.
Maybe.
It's
I don't remember.
Ruben Meridian.
Yes, but they post some really freaking awesome Hummers.
Mm-hmm. He does a really good. I think it's Damage Control Customs.
I think you're right. Yeah, I think I remember that.
He was at range day.
Yes.
But the other reason, I think I'm just going to go right back to a previous question, because I realized I wrote this in my notes and I didn't say it. But the other thing that pushed me to go ahead and go to school now is because of the political climate right now. It's getting a little scary.
Mm-hmm.
And I feel like I need the formal training just in case there is a situation where people need help.
Right. I think that's very smart. I mean, it's the reason literally that I got into medical stuff, because I was like, look, the world's a scary freaking place. And if you look at the statistics, I mean, yeah, lots of people use firearms for self-defense and protection and things like that. But the chances of me are infinitesimally small of ever having to use my firearm. Haha, look, YouTube, I'm handling a gun.
Right.
But I have definitely been involved in medical stuff. Like, I have seen and didn't even know what to do. Like, throughout my entire life, I've probably been in multiple situations. So I was like, I'm gonna focus on this. And the more I see the world go insane around me, the more valuable I think it is.
Well, you've seen my medical bag, a Dietrich.
Mm-hmm.
I don't know that Sean's probably seen it in passing at range day.
Mm-hmm.
It's almost large enough to carry a body in. But
we can get you some body bags if you want some.
Well, I got a litter. I could drag somebody around.
Yes.
I've got the carabiner clips too. I listen in class.
Yes.
So it's one of those things where it's like, if I have it, most of the time I don't need it. It seems like every time something has happened is when they haven't had a med kit on them.
Yes.
So I'm like, Eric, here, take this. Put this in your truck. Here's a med kit for the prop trailer. All right, I have trauma kits in the back of my Mustang. I have trauma kits in the back of my Honda. I carry a small trauma kit with me if I'm on the motorcycle. I kind of see it as a good luck charm.
Yes.
Hey, I'm totally down with that. I mean, that's fantastic.
I've said before, it's like good healthcare insurance. Like, you really ultimately do want good healthcare insurance, but you don't want to have to use it.
Mhm.
So you want to have the good equipment, have the good training, have the right equipment, but you really don't want to ever have to use it.
Yeah.
Totally agree. What other kind of jobs? Like, so get your EMT basic, like, is it just being on a rig? Is that like the only thing that you can do, or is there other stuff out there?
I honestly don't know. That would probably be a comment for you, Skinny.
Yeah.
But
There's a ton of different things you can do. A lot of people just think maybe just get on the ambulance, and that's fine. Maybe you do want to spend some time on ambulance, spend a few years there, but there's plenty of other places you can go. Depending on where you're at in the country, even EMS services are different. Some EMS services are under the fire department. So maybe you do a dual role. Maybe you're a firefighter and you ride on the ambulance some days. Like, one day you're on an engine and maybe next day you're on an ambulance, rotate back and forth. There's some private services out there that maybe they just do dialysis transport, so they go take grandma back and forth to the doctor's office, things like that. They're not super exciting, but they usually typically pay very well. And then if a county service, it's a county-run service, so it's based, in the city or the county that you're at. So a couple of different departments you can look at depending on what you want to do, where you want to go to work at, and then there's tons of jobs you can do once you get your paramedic. If you want to go and be a flight medic on a helicopter, that's an option. In my area, there's 3 helicopters. So when those jobs come open, a bunch of people typically apply for them, but there's openings. You guys are not far of Atlanta, so there's a ton of flight services coming out of Atlanta, with Grady being there, things like that. You can go work in the emergency department. You can be like a tech in the ER. So you go and you're basically helping the nurses start IVs, give medication, kind of move patients around, things like that. Another cool job is a SWAT medic. I think that's a pretty cool job to do.
and you do that, don't you?
I do. So that's a fun part-time job for me. I love that. Get to work a lot with police officers and sheriff's office and things like that. So that's a fun. And then I have a friend who just left to go over and do a contract job overseas. He's in one of the embassies as a medic. So making great money. You're gone for a while on that one. But you can go do a year contract with that and make a lot of money doing the contract services.
Dang.
Cool.
So much room for activities.
That's right.
That's pretty epic.
It does. Basically you start with your EMT, that's doesn't take that long to get your EMT. And like Brandy said, you're going to ride a couple times in the ambulance to kind of get used to it. Riding backwards, kind of doing patient care while bouncing down the road. It's always fun. And you're going to do some time in the emergency room. That's where you're going to see a lot of your patients and kind of get more of your patient assessment stuff down, talking to you. And trauma patients, as far as typically finding out what's wrong with them, is pretty easy. It's the medical ones that you have to be an investigator on. Like, all right, you came to the hospital today because of this. Okay, maybe that's 5 problems, honestly. Maybe I have a runny nose, my foot hurts, my back's been hurting, and things like that. And so you kind of have to investigate, find out what's really bothering them, or maybe just being super vague about it. Like, I just don't feel good. Okay, what do you mean you don't feel good? And you're gonna have to pull questions out of them to ask them that. So you're gonna find too that most calls that EMS goes on do not require an ambulance. That EMS abuse is terrible. People, but it's an emergency to them, so that's the way I look at it. But it's somebody who has the flu, or they hurt their leg, or whatever. They don't really technically need an ambulance. You could probably go to an urgent care, but they're just there. That's probably 90% of your calls. 10% of calls, you're like, all right, this is awesome. Like, this is why I became a paramedic. Like, this is fun. So just to go in with that expectation of the that everything is, balls to the wall exciting is, you're going to be disappointed, but know that you're going to go there for grandma who doesn't feel good, who, grandma hasn't been feeling well for 3 days, or she just hurts in her back and she wants to go to the hospital or something like that. So you're there because someone's having a bad day, and your version and their version of a bad day may be two different things. So just be nice to people. Like that's the hardest thing, is like try to get across to the students is, and obviously, you are super nice, Brandy. I don't have to tell you that, but for EMTs out there, like, be nice. Like, you would be amazed of, go back to like your mom and dad or your grandparents when they were talking about Dr. So-and-so. They never said like how good of a doctor he was. Like, oh, Dr. John was so good. It was like, no, he was so nice to me. Like, he listened to me. He would pat me on the hand and tell me, it's going to be okay. Like, his bedside manner was awesome. Like, that's what made, when we talk about doctors, that's how we define our doctors, is how their bedside manner is. Not, oh yeah, he nailed that strep throat, or he nailed that flu, or, he knew exactly what was wrong with me. We don't talk about that. We talk about, oh, well, she just seems too busy to listen to me when I go in there. She seems too busy. She's just ready to see the next patient. Or she sits down with me. She listens to me all my problems. Like, she has good bedside manner. So be nice to people. You can screw a lot up. It's be nice to them, and everything will be okay.
Yeah, and I know from experience that I've had both ends of that. Like, I rarely ever had a doctor that just rubbed me the wrong way. Is the one I went to this was last year. My doctor sent me over to get a stress test and an echo. And when I went over there, he refused to give me the echo. He was like, oh, you don't need it. How do you even know? You don't know me. It's the first time we've met.
Yeah.
Wow. That's weird.
I found out later that I was supposed to go to the cardiologist I was seeing, but they didn't take my insurance, and I was going to have to come out of pocket a large amount for the stress test and the echo. So I chose another doctor on the list, and come to find out he was a competitor. Like, it was a competing practice of the doctors that I go to. So he was just being a turd to me.
Why? What?
Yeah.
Right?
So,
you could have earned a new patient. Like, I might have liked your practice better, but then you're going to be a turd to me. Guess what? I told everybody I knew how much of a turd he was. Like, don't go over there. This guy's a douchebag.
Good.
And for me, like, I'm okay with running the grandma who just needs a ride to the hospital. It's easy paperwork. Like, it's easy call. It's easy write. I'll chit chat with her. I'll flirt with her a little bit on the way to the hospital. It'll be perfect.
Hey, Grandma, how you doing?
Yeah, how you doing? You look good in that little moo-moo you got on. Like, it looks, so it's an easy call. If you ran every call that was someone was dying in the back of your ambulance,
it'd be awful.
You would be exhausted mentally by halfway through your shift. Yes, you're like, oh, I had 4 people die today. Like, that's not a fun job.
No, that's not awful.
I was looking over because I wasn't 100% sure. I was looking where you had said that there's different EMT basic, advanced, and paramedic. Mm-hmm. And I think that what my course of study is kind of falling in between, like, the advanced and the paramedic, because this school offers an EMR, which is just 3 small classes, and then an EMT, and then an advanced EMT, which are all certificates, and then up one more step up above that is the EMS Professions Diploma, which is what I'm getting, and then the next step up above that's the paramedicine. So
you will test in your advanced, then, won't you?
I will be. The class that I'm taking basically all the 3 certificates. That's the EMR, the EMT, and the AMET are all in my course of study. So I'll be advanced EMT.
So you should be able to give IVs. There's a lot of drugs you should be able to carry. Even having some basic cardiac monitoring abilities, like you may be able to look at a monitor and go, that's normal. That doesn't look normal. I don't know what that is, but that's not normal. And maybe you can fax it to a doctor to look at.
Dang.
So you're right there to paramedic. So that's pretty awesome.
So like some of the classes I'll be like, the one thing is like airway management. I'll be working on that. Shock and trauma. I got medical emergencies for the EMT and medical emergencies for the AMET, and then the clinical and practical applications for both. So yeah, it's going to be an interesting ride. No pun intended.
There's a lot of services who may put like an advanced EMT and EMT basic on the same truck. So you're a BLS truck, but you can handle a lot of 911 calls off of that truck. So maybe something like that is what you may be looking at too. But yeah, there's a ton of things. You are, as an advanced, you're going to learn splinting, patient assessment, learn how to start an IV, learn some diagnosing some patients. Like, all right, this is pneumonia, this is congestive heart failure. You'll be able to give a lot of drugs. So that's awesome.
That is awesome. Sounds like a pretty great course. What are some of the roles that an EMT plays? So
you're gonna be able to drive the ambulance. That's the fun part for most people. They're like, I want to drive the ambulance. And you're going to be able to do like long spine board, be able to splint, your CPR, run an AED. As an advanced, you're going to be able to look at some basic rhythms and kind of understand what's going on there. You're going to be able to give a lot of different medications. I can't remember them right offhand. I apologize. I should be able to pull that. But start IVs and patient assessment. You're going to be there to help the paramedic on those more serious calls. Those few calls that actually like, oh gosh, this guy needs intubation. He needs a breathing tube. So you're gonna be able to help that. You'll be able to place like a King LT or maybe a LMA or the IGL, one of those blind insertion airway devices. You're gonna learn about waveform capnography, about maybe this guy doesn't need oxygen, maybe I need to back him a little bit more. So you're gonna learn a lot of stuff in the next little bit.
That's gonna be interesting. Like I can't wait. I'm excited.
I'm looking forward to the text messages at night going, hey, I just learned about this.
Guess what I did today?
Yes.
That's so awesome. I'm so stoked. It's going to be amazing. Let's see. Where are we at here? Is being an EMT difficult, Skinny Medic?
Yes and no. Yes, it can be difficult. I talked about a little bit, that you're going to be there during someone's worst day. Maybe their husband died, maybe their wife died, maybe their kid is dying, and you're going to be there for that, and you're going to be etched in their memory for the rest of their lives. Like, those EMTs were super nice to me when my mom died or whatever, or when I was in that car wreck and flipped over, the paramedics, EMTs were super nice to me, or like those guys were jerks to me. My idea of an emergency and their idea of emergency may be two different things. So in their time of need, it can be stressful, and you're going to see a lot of stuff that you don't want to see, that you don't want to do anymore. But you're there to help them. Someone's got to be there, and you're there to help them. As far as a job, no, it's not that hard. You got to be nice to them. You're going to learn all the skills over the next year to perform those and be good at them. The splinting, the treating someone for chest pain, maybe some respiratory like asthma, things like that. You're going to learn all the skills to do that. And you have a book in your ambulance called Standing Orders that if you get lost, you're like, I don't know what to do with this guy having chest pain. You open up the book and it tells you, oh, you should see if this guy's oxygen saturation is less than 94%, you put him on oxygen. Check. Did I give him aspirin? Check. Did I give him nitro? Check. Is his blood pressure good? Like, it gives you step-by-step guidelines on what you should do. So the skills part of being an EMT is not that difficult. It's just you got to understand what you're there for, and you're there during someone's worst day, and it may be something that seems very stupid to you, but to them it's an emergency.
Makes a lot of sense.
Good point.
Absolutely. Is this like a 9-to-5 job? You just go in, clock out?
It can be. For most time, it's not. Most of the time, they work 12 or 24-hour shifts. If you're busier system, you're going to work 12-hour shifts. And those are, you're going to be busy in those 12 hours. If you're at a fire department role or you're at a slower department, you may work 24/48s. which is not a bad schedule. I've done both. I've worked 12-hour days. I've worked 12-hour nights, and then I've worked 24-hour shifts. My 12-hour night shifts were fun, and then I had a family, and it's not so much fun anymore. But all the cool stuff happens after midnight. Like your mom always told you to be home after midnight. Nothing good ever happens. Everything fun happens after midnight. I liked night shift. You could talk to people differently. You could treat people differently. You could fight if you wanted to fight. I worked inner city night shifts, so I had a lot of fun. And so the pay scale is a little different for 12 and 24-hour shifts, but typically, like I looked it up, the average pay for EMT straight out of school is $35,000 a year, which is not bad. Your advanced is going to pay more than that. And then paramedics, like my department starts out paramedic pay like $50,000. So for a 2-year associate's degree to come out making $50,000 is not too shabby.
Yeah, that's awesome.
I would say, like Brandy's kind of working on a little bit, but if you decided that you were going to make EMS a career, is to get your degree, because the average lifespan of a paramedic is 10 years. 10 years in, you're like, all right, screw this, I'm out. I'm going to go work at Home Depot or Lowe's. I've had enough. Or you're like, I'm going to be a supervisor. I'm going to be an educator. I'm going to go do this and do that. So you will need a degree if you're going to make this a full-time career eventually. So I would encourage any of the young people or older generation to get your degree while you're going through it.
Makes a ton of sense. Now, Brandy's just getting started here. I mean, she's got a lot of knowledge already, but what do you think are the most valuable lessons or the most valuable advice that you could give to Brandy and other people who decide that they want to kind of follow this?
We kind of talked about it throughout the show a little bit, but I was like, be nice to the patients. Remember that, this is their emergency and not yours. Be nice, eat healthy, make sure you're taking food with you on the ambulance. That way you're not having to eat McDonald's, Bojangles, or Burger King on the run. Try to pre-plan those food meals, drink water, things like that. Stay hydrated on the ambulance. That's the worst. Just stand in line at Taco Bell at 2:00 in the morning trying to eat, and you get a call. You're like, dadgummit. So now you're shoving 3 tacos down your throat, and you're trying to run the call. So kind of pre-plan your food, and ask questions. Like ask a ton of questions. Ask questions from your instructor. Ask questions to the providers that you're running to. You get to the hospital, and all the ambulance crews are standing around BSing. Just ask questions like, hey, what would you do different? You've been in this EMS career for 10, 20, 30 years. Like, what would you do different? You just kind of ask questions and be open to what they tell you.
Yes. Brandy, what's the thing that you're most nervous about?
I don't know. I mean, I don't have any. I'm not nervous to learn, or I guess the one small thing is I told Eric, I was like, I just hope I don't have to watch somebody die. Like, while I'm in class, clinicals. Other than that, because I've witnessed that before and it was traumatic for me, and if I could prevent that, I would. But if I can, help somebody to prevent them from doing that's even better.
Yep. I've been there. That is not a fun spot to be. I've had a couple of medical patients that we were working our tails off for, working our butts off in the back of the ambulance, and they code, and like there's nothing you can do. I watched a guy burn to death one night. Got hit head on, and we were ambulance was the first on scene. Fire trucks were coming. That dude was screaming his head off, and there was not a dang thing I could do. Like I had this little fire extinguisher, and it was just like pissing in the wind. Like it was nothing. And this guy burned to death, and that sucks. Like, there's nothing you can do about it.
I think this might be a good time to actually talk about dealing with that kind of stuff and talking to people and things like that. You have actually talked about it before, but it's probably maybe a good time to kind of revisit that. Like, how do you deal with the stresses? And Brandy just said that's like one of her biggest fears, and it may actually happen. How do you recommend people deal with those kind of things?
So I would hope, we talked about this before, I would hope, and if you do it any length of time, unfortunately, you're going to see it. You're going to see somebody just is in congestive heart failure, they're having a heart attack, or they're choking, whatever, respiratory problem, like a bad asthmatic, and they code on you. Or you see someone who's been in a bad car wreck, and you get there too fast. And this is going to sound really bad, but their brain doesn't know they're dead yet. It happens. We get there too fast, and the body's completely mangled, but the brain is still alive. So they're breathing. They're trying to stay alive, but there's parts missing. There's just too much internal damage, and the person dies. And I would hope that your partner is a strong leader at that time, and you talk after the call. You sit on the back bumper of the ambulance, and you digest that call from start to go. All right. When we walked in, she was sitting up. She's sitting in tripod position. She was talking in like 1 to 2 word sentences. Maybe we should have been a little faster for the CPAP. Maybe we should have done this. Or this went really well. Or we did this. We immediately put them on CPAP. We immediately did this. Maybe if she hadn't have been in the back bathroom where we couldn't get her out, maybe she wasn't 400 pounds, we could have got her out. And kind of digest the call really quick, down and dirty, and just talk about it. And then I would hope within a couple of weeks, you got to talk some more. Kind of go, all right, maybe it's a more formal setting. You're sitting on a tabletop. You're like, all right, this is that call. I'm still thinking about it. And you're still going to think about calls like that call I just talked about with the guy get head on. I probably haven't thought about that call in months or years, but it just pops in. Boom, I think about it. But if it's a call that's really bothering you, like you can't stop thinking about it, or it's affecting how you sleep, or you're having nightmares about it, you got to talk about it. You got to talk to someone. I have a friend of mine who's dealing with some stuff right now, and the psychologist is kind of reenacting the call to kind of make him go through it and reenact the call. So there's people out there who do that stuff, and we can't just hold it in. You got to talk about it, and there's going to always be calls that you think about that maybe when you ride by the house, you think about it like, oh, that's where that kid died. But they can't stay in your brain and affect how you live and affect your marriage or your relationship with your kids and stuff like that.
Yeah. Brandy, I don't know about Skinny Medic, but I just have a feeling that you're going to end up on an ambulance somewhere, like actually working and doing the job. I don't know. You keep saying you're not going to, but I don't think I believe you.
I don't know. We'll see. It's like I'm gonna moonlight as an EMT.
Exactly.
You can do it. It's fine. Like it's just it'd be fine. You could. Like I kind of think the same thing. I hope. Like I love EMS. Like I am an EMS nerd, and so I hope you get into it and you're like, this is it. This is my calling. I've missed it all these years, but I hope you enjoy it. I really do. I'm looking forward to talking to you after you've done some ride time and some clinical time. Like, all right, now let's talk. What do you think?
I had actually considered this as a career choice when I was younger.
Yeah.
I did. I was, once I realized I couldn't get in the military because of my heart condition, I was kind of tossing around public service. Like, I thought, well, I don't know if I could be a police officer if I can't pass the physical for the military, but maybe I could do something else. And I actually started to go. I went to college and I started taking a couple classes, and then I kind of switched gears because I got pregnant and I had, I was a single mom. So I kind of had to switch gears there. So I went into something that I already knew I was good at, which was, accounting. I'm a math person, so it was easy.
That'll be good when you're figuring out those doses of medications and things.
Yeah, when you start doing joy calculations, you're going to rock those. I'm over here writing on a whiteboard, scratching my head going, all right, now, pounds to kgs, I got that. How many per kg? Yeah, how many am I giving here? I'm over here writing on a whiteboard, trying to figure all this crap out.
So wonderful.
Oh, I've done so many different things that, like, for instance, you were talking about pounds to kgs. I used to work in a warehouse where it was a Japanese company. So everything was in kilograms or not kilograms. What the heck? Anyway, it was metric. And I was constantly having to, in my mind, like, convert to pounds. Okay, how many pounds is this? Okay. So I think the conversion is like 2.25.
Everybody's 100 kgs. Everybody's 220 pounds in the EMS world. Like, oh, Sean looks like he's about 220. We'll give him 100 kgs. Everything's good.
I actually am 220.
100 kgs makes the math easy. We're good.
Perfect. I'm glad it worked out.
This child is 100 kgs. Wait, what?
Yeah, what? No, we got charged for that. Like they have tape. It's not Browser tape anymore because you can't. But pediatric measuring devices, we call them. So you just lay the little baby down and it's color coded. Everything's perfect. So, but yeah, so I'm excited for you. Like I'm excited about the future of what you see, even as a part-time job. Like I'm now part-time EMS, and I love it. Like I love getting on the ambulance part-time. I love doing the SWAT stuff. I love doing the search and rescue. So I love it. So I'm excited for you.
I walked into we were just doing orientation, but I walked into the classroom and I was already looking at all of the, models and the dummies and stuff. And I was itching to go over there and start like touching stuff.
Whenever I walk into a room like that, I'm like, if I had to fight, who would be a challenge here? Maybe that's just me. I don't know.
Yeah.
I don't know that there was anybody in that room that I had to worry about.
Like when I'm getting on an airplane, I'm like, could take him, could take him, could take her. That 5-year-old ain't got nothing on me.
Liar. You're like, that girl scares me.
Like a spider monkey.
Yeah.
True statement.
And when you go to Belk's or JCPenney's, now you're looking at those models going, ooh, I'm going to touch that. That's what you are.
That's true. And I do. And I buy them off of eBay. And I've got a whole little thing set up.
Wow. EMI.
Yes,
Well,
yes.
That's for another episode on mental health.
Yes.
All right. That's
Speaking of mental health, tell me, Skinny, what is the, I kind of think I know, but I want to hear you tell me, why is it you have to take psychology?
Because you're a psychologist. I mean, honestly, like you will be so many, like, I guess we should talk about that in the EMT roles, is you're going to be an emergency physician. You're going to be a psychologist. You're going to be a cardiologist. You're going to be a home health nurse. Like you're going to have so many responsibilities. That's the thing about paramedics is we know just enough to be dangerous about a lot of stuff. Like I know just enough about cardiology to be dangerous. So psychology, like you're going to run a lot of psych patients that maybe they're bipolar, schizophrenic, they're off their meds, or their meds just get mixed up. So you're going to need to talk to these people. And being a female may actually really help you in that situation because these patients that are psychotic are having a manic episode. They don't want to. If I walk in there, Sean walks in, they may want to fight us because they just see me as an intimidation factor. Like, oh, that dude's got a rough-looking beard. I want to fight him.
I'm already thinking about it when I walk in, so it's fine.
Yeah. So you being a female, you can de-escalate some of these problems that people are having and know how to talk to them, how to calm them down, and kind of just ride to the hospital. They don't need an IV. They don't need any kind of medications. They just need somebody to talk to. So you're going to know how to handle those situations and how to de-escalate some of these issues.
Yeah, I kind of figured it might be, to help also get a feel for what they are experiencing, like to kind of read them.
Definitely. I mean, you're going to like body language. I know there's a lot of stuff you'll be able to pick up. All right, this guy is kind of blowing up on me. I need to back off and kind of, understand what his body language is showing. I guess that's another tip I can give is that you're going to learn Scene Safe BSI, and you're going to say that literally 1,000 times next year. You're going to say Scene Safe BSI, and everyone does the Scene Safe BSI dance. Like you wave your hands like you have pretend gloves on. And every student does it. And it's funny. It's hilarious. Like, because you're going to test for your national registry and you're going to learn about critical failures. For if you do this or you don't do that, you automatically fail your national registry exam. And that's one of them. If you don't walk in there and say, hey, my name's Brandy, Scene Safe BSI, you fail. So you're going to say Scene Safe BSI 1,000 times. And every call that I've been in a fight, or I've had a gun drawn on me, I've had a knife pulled on me, there was no like flashing sign that said, hey, this scene is not safe. This scene is not safe. It was all stupid stuff that I was either too tired to pick up on or too lazy to pick up on. And I go back going, you know what, that scene wasn't safe. Like it was something stupid that, I stepped across something that I'm like, oh, that should have told me the scene wasn't safe. And afterwards, you're talking to your supervisor or you're talking to your partner going, that was really dumb. We shouldn't have been in there. That we could have got killed. So understand that there's no flashing neon sign that says the scene's not safe. And so if you're in a situation and the scene's not safe, you have every right to back out and say, see you later. We'll come back in a few minutes when you can calm down, or we're going to bring some more friends and they have guns and they're going to make the scene safe. So always, we've had to tell people, I've been like, my system I used to ride with, I rode around the QRV a lot, and I would hear crews saying they need help, they need backup from cops, and we would just tell them on the radio, like, Medic 2, understand that you can back out of that scene. And they're like, oh yeah, I can leave. One of the biggest fights I was in was at 4:00 in the morning, and this guy was beating the crap out of me. And the supervisor was like, you could have left at any point. You could have stood up and walked out of that room. And I was like, I know, but I didn't want him to hurt himself. And I'm like, but you ended up in a nice fight. I'm like, yeah. And I could have backed out, but understand the scenes can be unsafe at any point in time.
Yeah. Good stuff. So going back to the psychology thing, you have to be like an analyst and a therapist, an analrapist, if you will.
Well, I mean, maybe that is one of the areas that, me being a little bit older, I'll have an advantage over some of the younger people, is that I've already experienced a lot of things in my life, good and bad. You
can relate to these people. I saying, like, I say that, don't. You do have you have life experience. This guy's
I've been in the back of an ambulance. I've had congestive heart failure. I've had asthma. I can empathize with some of these people.
Somebody's going to be really ticked off and say, hey, my boyfriend just broke up with me, or my girlfriend just broke up with me, blah, blah, or my wife is leaving me, I just got fired, or whatever. And you're going to have that life experience that, you know what, I've had some pretty low points in my life too, and I was able to bounce back. And you just talk to them, you just be that psychologist for 15, 20 minutes while you're in the back of the truck.
Sounds good.
Yeah, that's awesome. I'm like, hey, my name's Sean, Scene Safe BSI, and I've already decided that I could beat you in a fight.
See, but what we really know is what's happening is you're like, hey, my name's Sean. I have this friend named Jeremy, and he's going to come beat you up if I can't.
Oh, yeah, absolutely. It's Master Blaster Protocol.
Yeah.
All right, that's awesome. I'm excited to see where it all goes, Brandy. I can't wait to hear kind of like after you've been in there for a bit, just to see, was it what you thought it would be and everything else.
The first time I get to do something epic, I'm going to be like, hey, guys, guess what?
I know.
Yes.
I can't wait.
You got to put me back on the podcast.
Yes, I'm excited.
So great. So let's talk real quick about product of the week at Medical Gear Outfitters. This one is, what is it?
I was going to talk about the shirts there. We did subscriptions boxes last month, so those are still going great. If you guys are interested in those subscription boxes there too, but our civilian medical podcast shirts are there. The profit goes back into the podcast to help Sean and I do this podcast. So you're purchasing those shirts just to help support us. So I appreciate it.
Yeah, it is awesome. And they are really hilarious. I started to order one the other night and then got distracted. So I'll order one today because I love them. And because
that's one of my jobs too, is I help manage Ballistic Ink.
I know. One of your 47, you're going to be like on the ambulance, like doing business stuff and all.
Hang on, let me answer this email.
I have been there, done that. Like, I used to carry my laptop, and if we were not on a call sitting on the side of the street corner, I had my laptop out and I was answering emails, ordering supplies, and all that stuff on the front seat of an ambulance.
Yep.
So wonderful. All right, that's good stuff. Go check out Medical Gear Outfitters. Those subscription boxes are all the medical stuff that's out there. Civilian Medical is the coupon code, and it gets you 10% off every day. And that's medicalgearoutfitters.com. Brandy, thanks so much for joining us again. And
thanks for having me.
So excited about your journey.
Yay.
All right, we'll talk to all of you next week.
Find us and subscribe at civmedical.com.
Is it